Well, the holidays are all about seeing family and friends that we haven't seen in a while, so we all want to look great when we do that. Dr. Bill Johnson of Innovations Medical is here with part two of his Saving Face series. This time it's about restoring volume. But before we get there, tell me what this is that you have brought.
Well, this is our award for being one of the Dallas 100, which is awarded to the top 100 growing businesses in North Texas. And we're very honored to be part of that group, but most of all, we wanted to thank our patients and our viewers who have really made this possible for us, because without them, we wouldn't have been here, much less been named one of the top 100. And we also want to thank the cast and crew of Good Morning Texas. You guys do a great job. You make it very easy to be here. Thank you.
Well, we're so proud of you. Congratulations on the award. Now, last time you were here in part one of the Saving Face, you were talking about things to do with the surface. So recap quickly what we talked about.
Yeah, we talked about the resurfacing lasers like Fraxel Restore or Smart Side Dot that really do a great job at getting rid of those pigment areas, so the fine lines and wrinkles. They can do a great job on acne scars. We talked about Thermage, which is probably the best non-surgical means of doing skin tightening. And now with the new CPT or Comfort Pulse technology, we can really do it with minimal discomfort as well.
Yeah, we talked about how quick and clean and easy that was to take care of that process. Now, so those are the surfaces.
Right.
Today we're talking a little bit about things you can do underneath the surface to restore that volume to the face.
Yeah, that's one of the things that's really starting to come to the forefront as we look at facial rejuvenation. Is so much of what happens with aging is we lose volume. So you first look back in the early collagen injections of the 90s, and of course there was so much overcorrection done that we all got that fat look and nobody likes it. The products now are so much better and the techniques are so much better that we really look to just restore the volume that's been lost. And Restylane, Radius, those kinds of products, we use them primarily around the mouth, some on the cheeks and eyes, and just starting to where we're using them off the face, on the hands in particular. Radius can do a great job for the back of the hands.
So those are some short-term changes, right? Those are things that they'll last for a while, but they're not permanent. What if we're interested in longer-lasting solutions?
Well, probably the thing that's really coming to the forefront, you're going to be hearing a lot more about in the next few years, is facial fat transfer. And we actually take the patient's own fat and then put it back and restore it to where it's been lost. So we can fill the folds around the mouth, restore the lips. When we plan this, we actually will take a picture of the patient from around age 18 to 20. And we will use
and look at where they were back then.
Exactly.
Interesting.
We take that picture of where they were, we put it up against the picture taken today, and we actually use that to plan how much fat goes in each area.
And you use the body's own fat, their own fat, to re-inject into those
there's
spots.
no chance of rejection, there's no chance of a reaction.
So if you're a huge fan of Bacon Week, you can just say, I'm just preparing for my facial work later.
There you go.
I think it's fantastic. Well, we see now why, always at the forefront of technology, why you guys are an award winner. We are so glad to have you here, and we will see you again soon. Congratulations again. All right, if you want more information, just log on to innovationsmedical.com or call 972-331-8844 for a consultation. If you have questions for Dr. Bill Johnson, drop him an email at questions@innovationsmedical.com.